So, for the effects of side effects. It's a very wide spectrum of the topics, so I will focus alternative treatment on herbal treatment. Of course, what I'm going to say here is mostly anxiety disorders which exclude OCD. Of course, I'm not saying let's treat anxiety disorders with plants. However, we have to consider that the concept of resistance in the West, or the concept of resistance in our specialized anxiety clinics, today under very tough circumstances in a place like Bakuke where I work, when you see 40, 50 patients a day and allocate 10-15 minutes to each one of them. In those polyclinics, the concept of resistance, of course, should not be put in the same category. As the first speaker said, the concept of resistance has to do with socioeconomic problems, the role of the disease, the problems arising from the limited time the physician and the patient spend together, especially the concept of resistance in the polyclinic. I will be looking at it from a different point of view, how we can overcome that, and can alternative treatments help us do that. I'll be talking about those. Of course, when we say herbal treatment, we should not be ignoring we never think about it, but in psychiatry we basically use lithium, which is a salt, and especially tryptophan is an amino acid, and these are also natural treatment methods, especially outside of Turkey. These are regarded as natural therapies, and we have some valid data related to those. Of course, about natural drugs, we do not have trials or meta-analyses. Most of them come from Germany, but I will briefly go over some drugs that are used in anxiety disorders. One of these is GABA. They talked about the GABA mechanism. GABA by itself is an amino acid, and it is efficacious in anxiety disorders. As you know, it has a sedative effect, and it lowers anxiety, and its daily use as natural GABA is 500 to 1,000 milligrams, 1 or 2 times a day, causes a natural anxiolytic effect. Of course, something being natural, does that mean it has no side effects whatsoever? About 2 grams, there is nausea, vomiting, and hypertension. Also taurine, this is also an amino acid, and it has GABA-like anxiolytic and sedative effects. It's found in animal food, and in strict vegetarians this may be deficient in the body, but the body can manufacture it from L-cysteine and L-methionine, but these 6 should be there. Dosage between 500 and 1,000, 1 or 2 times a day is allowed. Not much side effect reported. As I said just now, especially in polyclinics specific to anxiety disorders, one of the most important things we encounter today is anxious incompatibility. When you go to a polyclinic like this, taking a medication and finishing the day like that is highly likely, whereas these may really respond to alternative herbal treatments. There are some trials conducted abroad for that. When we look at the literature for anxiety, of course, when we say literature, apart from literature, the working literature, there are those without methodology, there are many encyclopedias, publications, tons of stuff, but even though not as much as medical publications, we try to go for publications that are close to scientific ones. So kava is one such plant, Pipermysticum. This does not contain alcohol, a Polynesian wine that is being used for 3,000 years. It's a methodical naturalistic study, I thought. Since it's been used for 3,000 years now, I'm sure it has some kind of efficacy. Of course, there's an active agent called kavain that it works over again. Kavalactones bind to GABA and benzodiazepine binding regions and cause similar effects. The longest study about this is a 25-week study by Waltz et al. Randomized placebo-controlled. Here, the kava extract has been found to be effective, WS1490. But Hitler and Ernst study in 2000, the quality score is ranked 3 over 5 because it has been performed in a family physician in the field of family medicine. So the diagnoses did not include any clearly diagnosed anxiety disorders. Kavalactone is used 2 or 3 times a day at 60-75 milligrams. Of course, in the kava extract, there are some side effects. In Turkey, I have not made a pure preparation, but the most frequent side effect is gastrointestinal irritation, allergic reactions, headaches, and photosensitivity. And it is a fat-similar. It has a fat-similar structure. It may cause toxic effects in the liver. That's why it's important for us in the future, because it's obtained from the kava root and extracted, but they have also glutathione. But within the extraction process, glutathione is subtracted, and glutathione is necessary for kava to break down in the liver, and especially if there's alcohol and medication burden on the liver, then there'll be toxic effects on the liver. Passion flower, passiflora used for relaxation, flavonoid, maltol. It does have alkaloids like that. Also, there's hormone and hormalols present in the alkaloid. This is important when you examine those, especially the alkaloids. There's a 0.32% level of benzodiazepine receptor effect. And the preparations in our country, we have syrups, 700 milligrams to 5 milliliter. Of course, there are lower dosage capsules, so when you calculate, approximately 2.24 milligram levels of benzodiazepine receptor binding active substance is here. It is used frequently in the community, and it does have a sedative effect in practice. Of course, in a study conducted abroad, Euphtos, of course, passion flower is pure in passiflora, but outside of our country, the most popular is Euphtos. It has valerian, officinalis, spalota, pleotita, but they bind onto benzodiazepine receptors. It has an agonist effect on muscarinic receptors, and especially trials in France show it is effective, superior to placebo, effective over the GABA receptors. Of course, especially after Robert Schwanen's speech here to the placebo effect, because when we're prescribing those medications, the disadvantage is the way patients view the medication, too many side effects. It will disrupt our liver. It will have an effect on our brain. That's what they're thinking. And when side effects are added, the patient develops a serious resistance or negative perspective. on the medication, whereas herbal medications, which are in widespread use outside of Turkey, 50 to 60% of society in the US use herbal medications, and they perceive it as absence of side effects, which is also wrong. Compared to medication use, even if it's not advantageous, they start with an advantage. And of course, the placebo effect is between 10 to 50%. You cannot underrate this. And this shows that this may, if placebo character or above herbal drugs may then be an advantage for us in overcoming resistance. We're talking about drugs and the effect of drugs, but when you look at it from the other side, anxiety disorder, 39 anxiety disorder trials conducted on 5 antidepressants. In 14% of the patients, antidepressants have been found to be superior to placebo, but in others, it's not superior. Also, 8,340 patients included 40 anxiolytic clinical studies. Again, in 48% of them, anxiolytics have been found to be superior to the placebo, and the remaining are not. Of course, for the past 10 years, apart from this, attributing positive effect to placebo has increased by 7%, and as working time got longer, the placebo effect got higher. Herbal drugs have a placebo effect on the patient because our patients, especially in our clinical practice, they have a more positive perception of herbal preparations compared with drugs. Another point here that we have to consider is placebo plus effect. Maybe the herbal drugs ensure this in a way. Placebo plus means instead of placebo, an active agent is used, and especially in pharmaceutical trials, the use of something like atropine. And in herbal medications, even though they may not be that efficacious, again, the presence of a part that has an anxiolytic effect may be that also ensures a placebo plus effect. Of course, I'd like to draw your attention previously these anxiolytic drugs in panic disorders, alprazolam, paroxetine, in obsessive-compulsive disorder, clomipirene, paroxetine, fluvoxamine, fluoxetine, sertraline, and post-traumatic, etc. So these are all very efficacious in our daily practice, we all know. Talking about placebo effects, we should also consider, in general, in groups where placebo effect is higher, there are groups who have mild to moderate degree disorder, who are not suicidal, or who do not have significant comorbidities. When there's chronicity and when there's a worsening of the condition, of course the placebo effect, as we can expect, it gets reduced. In the use of active placebo, compared to drugs and active placebo, they're more effective 14% of the time. In the absence of active placebo, medications are more effective 59% of the time. And alternative treatments, especially herbal drugs and their anxiolytic factors, which decrease anxiety, do they create an active placebo effect which we cannot ignore in treatment? They probably work over endorphins and have a placebo-like effect which increases treatment efficacy. This is something that has to be seriously investigated. Something else that we keep ignoring is that maybe it's not an alternative to treatment, but psychotherapeutic placebo concept. Absence of systemic psychotherapy, but the presence of warmth and closeness. after systemic psychotherapy, this is where healing is observed most frequently. Concept of resistance and anxiety disorder is one of the factors which cause this. Limited time with the patient, then patient's resistance goes high, and because there's no psychotherapeutic placebo effect.